Hello and welcome to Pitt Street Research. My name is Stuart Roberts and I'm one of the co-founders of our company. And joining me on the morning of Wednesday, the 24th of January, 2024, is Mr. Steve Lydeamore, who's the CEO of Immuron, ASX IMC. And as you can see, he's from Melbourne. Steve, good morning.
Good morning, Stuart. How are you?
I'm very well. You've got a lot to be smiling about because Immuron had a great year clinically. The company that bought you, Travelan, good for managing travelers' diarrhea as well as a whole range of other indications. Turns out you're having your best year yet in terms of sales. Talk to us about what you've achieved with Travelan.
Look, that's right, Stuart. We had a great first half FY24. It's a travel medicine, as you mentioned, for prevention of travellers' diarrhea. And as you would imagine, during the pandemic, people not travelling, sales didn't do so well. So it went from a peak prior to the pandemic of around 2.7 million in sales down to almost zero. Coming out of the pandemic, I think we did something like 700,000 in the first financial year that I was with the company. Last full financial year, we did 1.8, and in the first half, so halfway through this financial year, we've already done 2.3. So that 2.3 is getting close to the peak pre-pandemic, and that's in a half of a year. So sales are going very, very well for that product, right. And there's a lot of growth left in it.
Yeah, and no surprises. I mean, this product has been around for a long time, and it's clinically proven to work against travellers' diarrhea. But what excites me about Immuron is now you've built out a whole platform based on managing various infections related to gut health. Let's talk about the phase 4 study that you're running with about 868 subjects, with a couple of militaries involved.
Yeah, so that's a study being run by the Uniformed Services University. So this is a US Department of Defense university. It's a randomized placebo-controlled trial in 868 subjects. The subjects are all either US or UK military personnel traveling to high-risk regions. It's
high risk not because of the human enemy, that's because of the bacterial enemy.
Yeah, it's deadly pathogens. Yeah, look, it turns out that the Department of Defense, they have a list of things that they're targeting for research, and infectious diseases is a big area for them. And the programs that we're working on are up there with the top pathogens. So enterotoxigenic E. coli, which is Travelan, is one of those. The Campylobacter, another therapeutic program they're running, is one of those as well. If a soldier gets diarrhea from any of these pathogens, they're not able to be warfighter ready, which is what the Department of Defense wants them to be. And that's why they're funding our programs, providing millions of dollars in grant money, assisting us not just with money, but also scientific personnel and clinical trial studies to demonstrate the potential to prevent these pathogens.
Right. And in the case of your 868 subjects, obviously it's that big so that we can get some statistically significant outcomes at the other end. But that's coming soon. You've completed recruitment of that one shortly, as I understand.
Recruitment, we're about 50% through on recruitment. Recruitment is targeted to be closed by the end of March, and we're hoping to complete the inpatient phase by June of this year. So, yeah, well advanced on that trial. This trial is important, I think, because it gives real-world evidence, and even in advance of applying to the FDA for a biologics license application from the product, which will require phase 3 studies. This study in of itself is a phase 3 type trial, but not under FDA IND. It gives that real-world evidence that may be sufficient to get the likes of the CDC Yellow Book or the International Society of Travel Medicine to put us into their guidelines for preventative treatment for travellers' diarrhea.
Right. So huge upside there, beginning with Travelan and then building out into these military applications. You've got a smaller study in Campylobacter pylori for a different product that is being conducted in conjunction with Johns Hopkins. Talk to us about that study.
Yeah, so Campylobacter is one of those targeted pathogens that the Department of Defense has on the top of their list. So it's not pylori. I think you're thinking of Helicobacter pylori.
Right.
Campylobacter it's a different shaped pathogen than ETEC, and for that reason, Travelan has some activity against it, but not sufficient. So the Navy has actually developed a new vaccine, which is a conjugated Campylobacter ETEC vaccine. With that, we've developed a new bovine colostrum active ingredient, Campylobacter product, which has just completed dosing in a phase 2 challenge study. So this is where healthy volunteers at Johns Hopkins have come in and volunteered to be infected with Campylobacter.
Right.
And they'd either been given our Campylobacter product or placebo. The intent of this phase 2 study is to show prevention of that pathogen causing diarrhea.
Right. And in the event of that success, obviously that will build out to larger studies, presumably again under the aegis of the US Armed Forces.
Yeah, that's our hope. On the back of successful phase 2, we'll enter into a new agreement with the Department of Defence to take that program forward, hopefully with more funding from the Department of Defence.
Right. And of course, the added advantage of running these kind of studies, obviously this one is in healthy volunteers, not necessarily military folks. But when you're working with clinical studies involving military people, they have to report for follow-up because they're under orders in that regard.
Oh, no, even in the USU study, they are active US and UK military personnel. Well, they're all volunteers, so they're not under instruction. So, yeah,
All right,
full
so they're not
Helsinki protocol for running a clinical trial.
Oh, fair enough. Okay, so so yeah, they're not forced to do that, but nonetheless, there's a certain amount of discipline in terms of the people you're working with.
Yes, well, as you would imagine, armed forces are disciplined by their nature, and so compliance for those studies tends to be better than it would if you had lay people in trials.
Right. Now, having this conversation in January 2024, it's going to be a great year, 2024, by the looks of it. What are you most looking forward to?
Look, in our slide deck, and I haven't updated it since the last seminar I did on coffee microcaps, but we essentially achieved all of the anticipated milestones that we had for the second half of 2023 calendar year, and achieved one early. That's the Campylobacter inpatient phase. And in the next 6 months, we've got rich milestones coming up. So on the Travelan phase 2 study, we'd completed the inpatient phase. We should get top-line data reading out by around end of March, and the clinical study report hopefully by the end of the financial year. That's end of June 2024. On Campylobacter, we're this year, probably not in the first half, we'll get our top-line data and clinical study report. On the IMM-529, which is the Clostridioides difficile, we completed just before Christmas manufacture of CGMP material, and with that we generate data with the plan to file pre-IND by the end of June 2024. And the USU study that we just spoke about, enrollment for that is scheduled to close by the end of March 2024, with a view to completing the inpatient phase, that's dosing, by the end of this financial year, that's June 2024. So plenty of clinical milestones coming up, as well as, you can expect Travelan sales, our over-the-counter product, to continue to grow, not only in Australia, where we continue to grow strongly. I think we're the second fastest growing product within the diarrhea segment, second only to GastroStop. So we're doing very, very well and very popular with all pharmacies. But we're growing in the US through Amazon, and plan to launch in other channels, both direct to business and also direct to consumer. And we're on the verge of relaunching in Canada, which is quite exciting. So Canada is a similar market to Australia, slightly bigger population, but with a similar pharmacy setting, and we're hoping to replicate what we've done in Australia. Obviously, it will take a bit of time, but what in the Canadian market as well.
Right. And Canada's a market well. You lived for a long time in Toronto when you were a senior executive at Apotex.
Yes, that's right. So Apotex is Canada's largest pharmaceutical company. Big company in generics. Has some branded and consumer health products as well. I lived there for 9 years, so I know that market very well.
Right. Talk to us about Europe. Obviously, that's a potentially significant opportunity for Travelan. When do we intend to take it there?
Yeah, Europe's an interesting one. We've started some discussions with companies that specialise in gastroenterology. These companies have experience in both over-the-counter food supplements as well as prescription products in that gut health area. We're talking to them, but in parallel, we're thinking on the back of successful launch in the US and on Amazon, that we might target some markets in Europe as well. And English-speaking market, UK, is also a big Amazon market, and so we might have a look at launching ourselves directly in that market. So I read just the other day, and it surprised me, because I used to live in the US as well for about 4 years, and clearly in these consumer health products where Travelan competes, you'd think retail pharmacy is the largest market segment. Amazon's overtaken CVS as the market leader in that space now. So it is a good way to get to market, and it's a quick way that we can do it ourselves in markets like the
It's
UK.
amazing, isn't it? Amazon long called themselves the everything store, and sure enough, they're being successful at just about everything they touch.
They certainly are.
So, Steve, it's been a great 2023, and by the sounds of it, 2024 can be even bigger. Let's conclude by saying, what would be the thing that keeps you awake at night in terms of potential worries through the year?
You always worry about outcomes on clinical trials. So we've completed the inpatient phase on 2 phase 2s, and there's no reason to think they won't be successful, but you always worry that something goes astray and they're not. So that keeps me worried. But really, the main thing that keeps me awake is just finding ways to accelerate our growth of our over-the-counter product, Travelan. We've put out predictions, and perhaps people don't believe them, about market potential. So in the US and Europe, you're talking 50 to $80 million in sales potential, and yet we're running around in the low single-digit millions. The potential is not the product. It works. We know that it works. It's our capability of getting people to know that it exists, that they seek preventative treatment, rather than, at the moment, most people just treat diarrhea after they get it, with something like Imodium to stop bowel movements, and rehydration salts for after they've had diarrhea and the like. But clearly, it would be better for someone to pay a small amount of money for prevention and to have a good holiday than to deal with the consequences of one of those outcomes. And as the CDC predicts, if you travel to these countries, and for Australians that's Bali, and for Americans that would be Mexico or the Caribbean, 30 to 70% of people do get diarrhea. So there's a big market need for a product like Travelan, and there really aren't alternatives out there. If we're successful with our Travelan phase 2-3 program, we would be the first drug approved for prevention of travelers' diarrhea.
Right. So we've got, as McKinsey like to call it, growth in 3 horizons. We've got Travelan today, we've got Travelan tomorrow, and then all of the pipeline products that you're working on with the armed forces and others. Steve Lydeamore, now is a good time to be you.
Yes, it certainly is. Thank you, Stuart.
Thank you for joining Pitt Street Research.